This training will provide guidance for Prince George's County government employees about how to return to on-site work after COVID-19. The Prince George's County government currently plans to re-establish operations in several stages. In Stage 0, beginning on March 13, the county put the following measures in place. Allowed limited on-site work to employees performing essential functions who cannot accomplish work remotely. Required mandatory telework for employees who can accomplish work remotely. Closed county buildings to the public. Implemented sanitization practices to ensure regular surface cleaning and disinfection. Mandated the practice of social distancing in county buildings. Mandated the use of frequent hand washing and sanitization by employees while in county buildings. Made the decision not to allow in-person meetings or events take place. Only virtual or remote participation in events is approved at this stage. And suspended all official travel. In Stage 1, beginning on June 8, all measures taken by the count in Stage 0 remained in place. However, minimal critical function employees were allowed to return to on-site work, so long as there is only incidental contact with other employees. In addition, agencies were tasked with maximizing telework for employees who are able to accomplish work remotely. In Stage 2, the county will continue to move towards normal and safe business operations by opening county government buildings to the public and allowing additional critical function employees to return to on-site work based on operational needs with building entry health screenings in place. In this stage, cleaning and sanitization practices continue as previously outlined. Limited meetings are allowed to take place in person in county buildings with proper social distancing and PPE. However, the use of virtual meetings is still strongly encouraged wherever possible. Finally, in this stage only critical official travel is allowed by county employees. Finally, in Stage 3, the county will look to adopt a new normal for government operations, which will include resuming full on-site work for county employees, resuming full in-person services, with appropriate safeguards. All eligible employees remaining telework ready. County buildings open to the public, with appropriate safeguards. Continued use of social distancing, PPE, frequent hand washing and sanitization practices. Resuming of full in-person meetings, with appropriate safeguards. The encouragement of virtual/remote meetings. Resuming of certain larger events, meetings, and community forums with appropriate safeguards. And minimized non-critical official travel for county employees. The county government is currently in Stage 1 until further notice. A start date for Stage 2 and Stage 3 has not been set at this point and will be announced to county employees once it is determined. County government has continued to operate during the pandemic, and we have taken the necessary steps to ensure the safety of our employees, residents, and the general public, including closing county government buildings to the general public. Providing appropriate personal protective equipment, PPE, for employees who have continued to work on site. Performing deep cleaning treatments on county government facilities and continuing a regular cleaning regimen. Posting additional signage in county facilities to promote hand washing, social distancing, and COVID-19 information, and maximizing telework for employees who can perform duties remotely. The county government has gone through several changes in response to the COVID-19 pandemic. Beginning on March 11, 2020, the coronavirus outbreak was declared as a pandemic, and OHRM established a COVID-19 employee guidance website. On March 13, 2020, situational telework was activated for telework-eligible employees to promote social distancing. From March 20 to March 27, 2020, Prince George's County government reduced to essential functions to determine approach for safe work of county employees. From April 3 to April 27, 2020, OHRM issued expanded guidance and training for teleworking employees. On May 29, 2020, modified Stage 1 of county government operations was announced. On June 11, 2020, Phase 2 of county reopening was announced by County Executive. And on July 6, 2020, Stage 2 of county government operations was announced. Please note that policies and guidance provided in this training are subject to change at the discretion of Prince George's County Government to maintain the health and safety of county employees. You can view new updates about COVID-19 operations for Prince George's County Government employees on the OHRM website. To get our county employees ready to come back into the workplace, we will cover 3 key sections. First, employee protocols will provide guidance on practices employees can use for safe on-site work. Second, building protocols will provide an overview of what is changing in the workplace when we come back and review new employee protocols that will be put in place for working safely. Third, we'll review maintaining a healthy workspace to understand the policies for limiting exposure and addressing illness for employees. Finally, in our resources section, we'll review additional guidance and resources as well as provide contact information if you have additional questions. Let's get started. First, let's discuss the protocols and policies that employees should use to work safely and ensure community safety. Before returning to the office, you should coordinate with your agency leadership to determine if returning to the workplace is safe, feasible, and acceptable. To do this, you should consider the following items: your job function and expectations in the workplace. Are you experiencing any COVID-19 symptoms, such as fever or chills, cough, shortness of breath, fatigue, or body aches? Are others in your home experiencing any COVID-19 symptoms? Do you have a higher risk for severe illness, i.e. older adult, have underlying medical conditions? Do you live with or care for anyone with a higher risk factor for severe illness? Do you have any other factors that may prevent you from leaving home at this time? For example, do you have a lack of childcare or elder care, or are you tending to a sick family member? Please remember that you should never come to the workplace if experiencing any COVID-19 symptoms for your health and the safety of others. When preparing to return to on-site work, employees should be prepared by using the following tips. Stay informed by watching for information and instructions from your department/agency, and be sure to monitor news outlets, emergency alerts, local health departments, and other external sources about any new circumstances that may impact your return to the workplace. Use personal protective equipment or PPE by ensuring that you have materials that provide protection when outside the home, including masks/face coverings and hand sanitizers. You should also coordinate with your department to obtain any additional PPE that may be required for your specific job function. And plan your commute by planning out your commute ahead of time. Consider forms of transportation that minimize close contact with others, and check local transit authorities for updates about changes to services and procedures. The most important thing for every employee to remember is to please stay home if you are sick. Staying home helps to stop the spread of illness in the workplace and keep your coworkers healthy. When returning to on-site work, it is crucial that healthy employees returning to on-site work adhere to the following protocols to keep everyone safe. Maintain social distancing. Minimize face-to-face interactions. Use personal protective equipment or PPE. Maintain good hygiene. Participate in pre-screening. And keep workspaces clean. We'll review the details of each protocol in this section so that we understand what it will take to keep everyone safe. It is crucial that employees practice social distancing to help prevent the spread of COVID-19 and other germs. Practice social distancing by maintaining at least a 6-foot separation from others. This includes anyone utilizing any common space, including the smoking spaces, outdoor patio, and break rooms. In addition, all meetings must be less than 10 people to allow for proper social distancing, depending upon the size of the conference room. Meetings for more than 10 people should utilize virtual platforms to promote social distancing. Meetings in private offices should also be avoided, as these areas do not typically allow for social distancing. Finally, when moving in the workplace, practice social distance in elevators and follow building guidelines. Minimize meeting people face-to-face whenever possible. If guests visit the office building, be sure to make the visitor aware that the office is complying with social distancing guidelines, mask guidelines, and is a handshake-free environment. It is generally a best practice to avoid hosting on-site meetings in office spaces. Personal protective equipment or PPE will help prevent the spread of COVID-19. Be sure to wear personal protective equipment while you are in the workplace to help prevent the spread of COVID-19 and other germs. As demonstrated in the face mask image, to wear your face covering correctly you must put it over your nose and mouth and secure it under your chin. Masks and gloves are available for employees from their agency. Employees must wear a mask in all common areas of the building and in office space when interacting with others, as well as anywhere you are unable to safely distance yourself from others. Please be sure to wear your face covering correctly by following the CDC guidelines, which include: wash your hands before putting on your face covering. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face. Make sure you can breathe easily. And be sure to wash your face mask on a regular basis. Please note that wearing a face shield alone does not offer enough protection. As a result, face shields must be worn with a mask by employees. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place, or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Be sure to cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Wash your hands often, but especially during key times, including before eating food, before and after treating a cut or wound, after using the toilet, after blowing your nose, coughing, or sneezing, and after touching garbage. To ensure the safety of all employees, please stay at home if you are sick. Before entering the workspace, every person must participate in pre-screening process that is not recorded, which includes a temperature check with a non-contact thermometer and verbal social distanced health screening symptom questions. Individuals may be refused entry to the building if an individual answers yes to any screening question, has a body temperature of 100.0 degrees or higher, or refuses to answer the screening questions. Employee refusal to answer screening questions may result in employee being placed on unauthorized leave without pay and/or disciplinary action. Please be sure to use signage posted to use designated entry and exit doors in county buildings to minimize exposure in county buildings. County buildings are closed to the public in Phase 1 of reopening. When county buildings open, it is important to keep workspaces clean. To do this, all county buildings will sanitize high-touch common surfaces and areas no less than 3 times daily. This includes common surfaces such as doorknobs and handles, ledges and handrails, elevator buttons, and light switches. It also includes common spaces including break rooms, restrooms, entrances, and conference rooms. Employees must also disinfect surfaces using cleaning materials provided by their agency after using any items in common areas, including countertops, vending machines, microwaves, coffee machines, refrigerators, and tables. While in the workspace, employees should avoid sharing equipment to avoid the spread of disease such as personal computers, mouse, keyboard, and phones. Employees must use gloves or hand sanitizer when touching shared equipment in the workspace. This includes photocopiers, fax machines, and the personal computers or equipment of other employees. Next, we will discuss building protocols to help you understand the operational procedures the county government is taking to ensure we can all work safely in county government buildings. When returning to on-site work, employees should be prepared for physical and operational changes in the building, including: first, temperature checks and wellness assessments will be implemented. All employees and visitors will have their temperature checked at entry. Persons having a temperature of 100 degrees or above will be denied entry. Employees must complete a wellness assessment prior to returning to the work site. The assessment will ask questions about possible exposure to COVID-19. Second, protective equipment will be required. Employees must wear a mask in all county government facilities at all times. Gloves are required when handling files and mail. Each employee will be provided 5 reusable masks. Protective barriers are being set up in public-facing areas. Certain employees will also be provided face shields to add for a greater level of protection. And finally, social distancing signage will be visible throughout buildings. Signage meant to enforce social distancing will be installed in high-traffic areas. Please be aware of your surroundings. Stairwells are marked one way and there are occupancy limits posted in common areas including elevators. When entering the building, employees should expect a few changes. You should be prepared to queue for building entry and to complete a wellness screening. For employees traveling by public transportation, please plan to use a sanitizing station upon arrival. Use designated employee entrances to enter the building. And all employees will be subject to a temperature check and wellness screening before entering the building. Once you enter the building, it is crucial that you navigate the building safely by keeping the following tips in mind. First, stairwells will be marked for use in one direction to prevent cross-traffic. Be sure to maintain social distancing when using stairs and use hand sanitizer available at stair entry and exit points. Second, when using elevators, keep in mind that elevator usage will be limited to 1 person per cab. Floor markers near elevators will identify queuing areas for elevators. Finally, when navigating hallways and corridors, follow signage and floor markings. Be sure to travel on the left, and always maintain a 6-foot distance from others. When in public common areas in county government buildings, please keep a few tips in mind. When in waiting rooms, pay attention to capacity limits in waiting areas. Always maintain a 6-foot distance from others. Use one-way travel patterns indicated, and always wear a face covering. Cafeterias in buildings will only be open for grab-and-go food options, and also keep in mind that any seating provided will be limited. Finally, while the information desk in county government buildings will be open for visitors, please use the queue lines marked to maintain safe physical distancing. When in workspaces, employees should keep several safety measures in mind. One-way travel designated in all work areas. Limit unnecessary movement within the office. Open workstations will be outfitted with panels for additional protection. Limit office occupancy to 1 person at all times and do not hold meetings in offices. And meetings must be in a space where 6-foot physical distancing can be maintained. When using conference rooms, there are several things that employees can do to ensure the safety of everyone using the space. Be sure to adhere to the maximum capacities identified for all meeting spaces posted in conference spaces and plan to allow for a 6-foot separation between occupants. To support the safe usage of conference spaces, furniture will be removed or taped off to limit usage, and sanitization stations are available in meeting spaces. When in common areas, employees must be vigilant to ensure everyone's safety. First, in the mailroom, limit capacity when in the space, use the sanitization stations available, limit daily retrieval of mail, and when mail is retrieved, be sure to wipe down the departmental mail cubbies after use. Second, in the file and archive rooms, limit capacity when in the space, use the sanitization stations in rooms that require document review, and be sure to wipe down surfaces after use. Finally, in pantry and copy areas, always maintain social distancing, limit capacity when in the space, use the sanitization stations, and be sure to wipe down surfaces after use. To help maintain a healthy workspace, there are several policies the county has put in place to limit exposure and address illness at work. To maintain a healthy workspace, we need every employee to restrict travel, report workplace exposures, Recognize sources of exposure. Work safely if you are a high-risk individual. Use telework. Work safely with COVID-19, if needed. We'll review the details of each policy in this section so that we understand what it will take to maintain a healthy workspace for our county employees. To limit the spread of COVID-19, travel during COVID-19 is restricted. Only business-critical travel is possible at this time. Any travel must be pre-approved by the county government chief administrative officer. Upon return from travel, an employee must complete a 14-day quarantine before returning to the workspace. If you are aware of any COVID-19 exposure in the workplace, please notify Human Resources. Employees must immediately inform your appointing authority and/or approved designee of any positive COVID-19 cases in employees that you are aware of to keep our employees and workplace safe. COVID-19 cases reported to the agency will then be reported to the Office of Human Resources Management and the Department of Health. An employee's risk for COVID-19 is based upon the work location and type of work. Detailed information about exposure risks can be viewed on the Occupational Safety and Health Administration or OSHA website. The virus is thought to spread mainly from person to person between people who are in close contact with one another. That is within 6 feet of each other. The virus spreads specifically through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. It is also possible for COVID-19 to be spread by people who are not showing symptoms. In addition to person-to-person exposure, a person can also be exposed to the virus on an infected surface. This occurs when a person touches a surface or object that has the virus on it and then touches their own mouth, nose, or eyes. The spread of virus via touch is currently not thought to be the main way the virus spreads. It is important that employees who are high-risk individuals continue to work safely. If you are in a high-risk category and have concerns about your return to the office, please reach out to your agency Human Resources liaison as early as possible before returning to on-site work. The most common high-risk individuals include, but are not limited to, people who are immunocompromised, older adults, people with asthma, people with HIV, and people with liver disease. A complete list of high-risk individuals is available from the Centers for Disease Control and Prevention or CDC website. To promote a healthy workspace, employees are encouraged to telework if possible. Telework can continue to be used by employees if approved by the appointing authority. Agencies can implement telework effectively when employees return to on-site work using the following guidelines. First, create blended work schedules. For example, create a schedule where an employee is in the office 2 days and teleworks 3 days during the week. This type of schedule helps to rotate employees in the office and promote social distancing. Second, agencies should use alternative work schedules or AWS to stagger employee work schedules to promote social distancing in the workplace. Finally, agencies can require teleworking for eligible employees a few days a week to promote social distancing in the workplace. Employees who test positive for COVID-19 can continue to work safely if they are able to follow several protocols. Employees with positive COVID-19 test results must meet the following criteria before returning to on-site work. The employee must work from home or take leave for at least 14 days, if possible. Or the employee must be cleared by a medical professional to return to on-site work. The presence of COVID-19 symptoms require an employee to work from home until they are symptom-free for 72 hours. In accordance with new laws passed in response to COVID-19, employees should use leave available through the Families First Coronavirus Response Act or FCRA. Information about FCRA is available on the OHRM Medical Leave website. This chart provides an overview of the FCRA benefits available to county employees. The document provides guidance on the reason why an employee is unable to work or use telework, the payroll code associated with the use of FCRI, the type of benefits an employee is eligible for, and the maximum benefits that will be paid to an employee based on their reason for using FCRI. You can view the full FCRI benefits at a glance document on the OHRM Medical Leave website. Employees recovered from COVID-19 illness are required to maintain isolation for at least 10 days after illness onset and at least 3 days, 72 hours, after recovery. Illness onset is defined as the date symptoms begin. Recovery is defined as the resolution of fever without the use of fever-reducing medications with progressive improvement or resolution of other symptoms. Ideally, isolation should be maintained for this full period to the extent, if possible. In most cases, employees will be cleared for return to on-site work using the symptom-based strategy for evaluation. If the employee is in a high-risk category for transmitting infection based on their job role, re-entry to work will be considered on a case-by-case basis. In our final section, let's review additional guidance and resources you can reference as you transition back into the workplace. There are several policies that were referenced in the development of this training. These policies include the COVID-19 testing, quarantine, isolation, and contact tracing policy, which provides guidance for COVID-19 testing, contact tracing, and quarantine/isolation of county employees. The county's glove policy, which provides guidance for the use of gloves in the workplace by county employees. The county's health policy for reopening, which provides guidance for the screening of staff and guests at building entrances and county building protocols. Administrative Procedure 255, Employee Dress Code and Mask Wearing, which provides expanded dress code guidance for the use of masks in the workplace by county employees. The PGCG Return to Work Protocols Guide for Employees, which provides guidance for the safe use of workspaces for agencies that plan to resume use of administrative and technical workspaces. The OHRM COVID-19 FAQ document, which provides guidance on reporting COVID-19 exposures in the workplace for county employees. The Telework and Alternative Work Schedule Policy, which provides the policy and resources for the use of telework and alternative work schedules for county employees. And finally, the county's travel policy, which provides guidance on official travel for county employees during the COVID-19 pandemic. All COVID-19 return to on-site work policies can be viewed on the OHRM website included in the Resources section. Additional information from the state of Maryland and Prince George's County can be accessed on the Maryland Department of Health COVID-19 website, the Prince George's County COVID-19 website, and the Office of Human Resources Management COVID-19 resource website for employees. If you are a county employee completing this training in the County Learning Management System, you can download your certificate by logging into your LMS account. Detailed instructions can be found on the OHRM Center for Learning and Development website. If you are a county contractor completing this training to receive credit, you must complete the training acknowledgement form and submit it to your agency Human Resources Liaison. You have now completed the returning to on-site work after COVID-19 training. If you have any questions related to returning to on-site work after COVID-19, please feel free to contact the Prince George's County Government Office of Human Resources Management via email at orem@co.pg.md.us or via phone at 301-883-6330.